AARP believes all Americans should have affordable healthcare choices. We've developed 6 priorities for health reform. These are fair and common sense solutions that will lower costs, improve quality, and give all residents affordable healthcare choices. First, we must guarantee access to affordable healthcare choices for everyone age 50 to 64. I mean Americans age 50 to 64, not covered through an employer. AARP is making the case that insurers can no longer deny and charge higher rates based on age or health status. In Hawaii, as has been recently reported, nearly 11% of residents in this age group are without health insurance. As the economy worsens, this number is likely to increase. Second, we have to make prescription drugs more affordable. To do that, we must lower out-of-pocket costs by closing the Part D coverage gap, better known as the donut hole. In Hawaii, the share of Part D enrollees caught in the donut hole reached 36%, or 33,000 beneficiaries in 2007. That's the highest percentage figure in the country. Third, we want to prevent costly hospital readmissions by creating a Medicare follow-up benefit to help people transition home after a hospital stay. We must protect patients' access to their doctors and crack down on the wasteful spending, medical errors, and poor care that drive up healthcare costs for everyone and result in costly rehospitalizations. In 2004, in Hawaii, over 17% of Medicare beneficiaries discharged from the hospital were readmitted within 30 days. Providing a follow-up benefit for Medicare beneficiaries would help save billions and improve outcomes for patients. Fourth, we must increase federal funding and eligibility for home and community-based services through Medicaid so that older people can remain in their homes as they age and avoid more costly institutional care. Even though local residents overwhelmingly say they want to stay in their homes as they get older, the state now spends 83% of its Medicaid long-term care dollars for older people and adults with physical disabilities on nursing home care, and only 17% on home and community-based services. Fifth, we want to create access to generic versions of costly biologic drugs used to treat cancer and other serious illnesses. Today, half of all Americans say someone in their family has skipped pills or postponed or cut back on needed medical care because it costs too much. That's a choice nobody should have to make. In 2005, about 60% of Medicaid prescriptions for Hawaii residents were filled with generics, and if generic equivalents of biologic treatments were also available, residents here could save millions of dollars a year. Sixth, and finally, we're seeking to improve programs that help people with low incomes on Medicare so they can afford health care and prescription drugs they need. In today's economy, when millions of people in Medicare have seen their retirement savings shrink, they're spending on average 30% of their incomes on out-of-pocket health care costs, including premiums for supplemental coverage. Their costs are 6 times greater than for people who have employer coverage. In closing, there's no magic bullet that will solve all of the nation's healthcare challenges, but AARP believes there are common sense health reforms that are ready to be implemented, and the costs of doing nothing are simply too high. Thank you.